Thank you so much for joining our webinar tonight. My name is Ann Garvey. I'm the Deputy State Epidemiologist and State Public Health Veterinarian. And I'm going to start our discussion tonight and give you some background on the virus and talk to you about what we're doing for monitoring and what we're recommending that healthcare providers do to screen their patients for COVID-19 infection. This webinar will be archived, so it will be recorded and it will be uploaded to YouTube so that we can share that link with you all. If there's parts of the webinar that you missed, you can go back and view that, and you can also share that link with others in your departments that weren't able to join tonight. So expect that link to come out to you tomorrow. It'll come to all registered participants. In addition, we'll send the slides that we're using tonight so that you can use those in your discussions with other personnel as well. The goal of our webinar is to, again, give you some background information on COVID-19 activity. We want to talk to you about some of the updated or new state and federal guidance and discuss some additional preparedness and response recommendations. So COVID-19, when we're talking about COVID-19, we're talking about a coronavirus, and coronaviruses are a large family of viruses. Some of these viruses only infect animals, some infect people, and some infect both. 7 of the coronaviruses are known to infect people, and 4 of them are extremely common. They usually cause mild to moderate illness, and most of us have been infected with at least one of these 4 common viruses at one point in our lifetime or another. And these viruses can be detected on our standard viral respiratory panels. So if you hear someone say, I went to my doctor and I was diagnosed with coronavirus, I tested positive for coronavirus, what they're talking about is one of these 4 common viruses, because again, these circulate widely in our communities and they're really common this time of year. Now, there are 3 more rare coronaviruses that infect both people and animals, and that includes MERS, SARS, and COVID-19. These viruses can cause more severe illness like pneumonia and life-threatening illnesses, and they, at this point, are not detected on the standard respiratory panels that are being run at healthcare facilities. And further in the presentation, I'll talk to you a little bit about where testing is being done right now and where testing could be done in the future. So a little more background on this virus. The virus was first identified in Wuhan, China. That's in the Hubei province. And many of the initial cases were associated with a wet market, so a market that sold seafood and animals. And that suggested, the early data suggested potential animal to person spread. But now this virus is spreading person to person throughout communities around the world. And it's especially spreading in people who are in close contact with each other, especially within 6 feet. So we'll talk about this later in the presentation a bit too. The WHO is recommending that droplet protection be used, but CDC is recommending airborne protection. So if you're seeing some guidance that's a little bit discrepant, that's the reason for it. There's a little different guidance being used internationally as opposed to what CDC is recommending right now. So we're really most concerned about having contact with people within 6 feet. And people are most contagious when they're the sickest. Excuse me. So this dashboard is from the WHO's, the World Health Organization's website. It gives us updates on the numbers of cases that are being reported around the world. This was the data as of this morning. I'm sure it's very different now, but as of this morning, there were 93,000 cases, over 3,100 deaths, and cases had been reported in 77 different countries. So as we move through this response effort, if you're interested in where the cases are being identified around the world, this is a great resource to look at. And you all know this already, but we really want to emphasize how quickly this response effort is moving, how quickly things are changing, how this virus is being identified in countries around the world on almost a minute-by-minute basis. And so we just want to acknowledge the quick movement of this outbreak. We know that it's hard to follow all the new guidance and all the new recommendations. We understand that. We're feeling that too. And we just want to, acknowledge that and make sure that you're all checking our website and the CDC website for the most up-to-date information. So this slide shows the CDC numbers of confirmed cases in the US and the states in which those cases have been identified. So again, CDC is updating their website regularly, and that's the place to look for the most up-to-date national counts. Here at Iowa Department of Public Health, we are sharing numbers of people being monitored, and I'll talk to you a little bit later in the presentation about what I mean by people being monitored. We're also sharing numbers of people being tested and obviously the results of that testing. These numbers are being updated every Monday, Wednesday, and Friday. And certainly if we had a positive case, we're not going to wait for the next Monday, Wednesday, or Friday. We would be working with our partners to send out those notifications right away. This is an important slide, and I'm going to reference back to it quite a bit in the future discussions, but this is a slide that shows the current traveler health notices that are in place from the CDC related to coronavirus, to COVID-19. And so obviously China and Iran have the highest level of health notice, followed by South Korea and Italy and Japan. And we'll use the term area affected by COVID-19 quite a bit. And when I'm saying area affected by COVID-19, what I mean is those countries that have either level 3 or level 2 travel health notices in place. So as of this minute, that includes China, Iran, South Korea, Italy, and Japan. But again, like we mentioned earlier, it's important that you're checking these websites somewhat regularly because these travel health notices have been moving, things have been moving onto this list really frequently. So I want to transition a bit and talk about monitoring of travelers returning from mainland China and from Iran. So the President's Task Force on Coronavirus has dictated that states will be monitoring people returning from mainland China and returning from Iran. So I'll talk you through the process of how this is happening. The reason that we're focusing on these two countries is because these countries have the highest rates of illness. Even though we have additional countries that have level 3 travel notices in place, the rates of illness are lower than what we're seeing currently in China and Iran. So the way this monitoring is taking place is that people returning to the US from China and Iran are being funneled to 11 airports, and those airports are listed on this slide. When they arrive at those airports, they're being assessed for symptoms. If someone's sick, they're being referred for health care, and if appropriate, they're being tested before they're being released to travel to their destination. If people are well when they arrive at the airport, they are allowed to continue to their destination, and CDC is collecting all of their contact information and sending it to the state health department where they're going to be returning to via a secure communication system that we use for a lot of different communications with CDC. When we receive that notification, we'll follow up with that individual to assess the level of risk, the level of exposures that they had in the country where they're returning from. And there's more detailed information that dictates whether someone's at high risk, medium risk, or low risk. That's posted on the CDC website if you're interested in that. But I'll just keep this kind of brief and higher level. If someone is assessed to be at high risk, then we're issuing a high risk voluntary home confinement order. So that confinement order requires that individual to stay home for 14 days after they left either mainland China or Iran. If they're not cooperative with that order, we'll issue a home quarantine order. Anybody at medium risk has the same restrictions. However, they are allowed to take a walk outside, ride their bike, go jogging, and someone at low risk does not have any movement restrictions in place other than if they're going to travel long distances, they need to coordinate that with public health before they go so we can make sure and continue to monitor them when they're traveling. So what's common across all of these risk levels is a component of the order requires these individuals to check in with local public health twice a day to ensure they remain fever-free and that they're not having any respiratory symptoms. So our local public health providers or partners have been assessing these returning travelers from China, and now that will include Iran. That was a recent addition just yesterday, as they return to Iowa to make sure that they remain healthy. So if you're ever interested, I'm going to move through the slides backwards here. If you're ever interested in the numbers of people being monitored, that's posted on our website. It's the top table. So far, 39 people have completed monitoring, meaning that they stayed well for their 14 days. And we currently have 5 people under monitoring. We're getting a lot of questions related to what about the rest of the people that are traveling to the US from the affected areas. And we're asking anyone that traveled to the US from an affected area, and again, an affected area includes those countries that have either level 2 or level 3 traveler health notices in place, to stay home for 14 days after they leave that country and monitor themselves for symptoms. If they get a fever or respiratory symptoms, they're asked to call their healthcare provider and make sure their healthcare provider understands that they've traveled to one of those affected areas prior to going into the medical office. And then their healthcare provider can consult with them on the phone to give advice on whether they need to be seen in the office. And if they do, give them special instructions that might need to be followed to make sure they're seen in a way that doesn't expose others. On the slide, we list those some of the affected areas. Again, we're not listing China and Iran because those people are being mandatorily monitored. So this is our recommendation. We're not notified of these people when they come into the US. There's no contact information collected and sent to us. So we don't have an ability to follow up with people coming back from Italy, Japan, and South Korea. So I'm going to shift gears and talk about the screening that we're asking our healthcare providers to do, either at point of check-in or, oops, we're missing a slide there, either at point of check-in or when a person registers at the desk. So we're asking our healthcare providers to really screen based on 3 specific questions. We want them to ask, do you have a fever or respiratory symptoms? Did you travel from an affected geographic area within the 14 days of getting sick? Or did you have close contact with a laboratory confirmed case infected with COVID-19 in the 14 days before you got sick? If those individuals answer yes to 2 of those 3 questions, then we want the healthcare providers to don appropriate PPE. Let me back up. If the patient responds yes to those and that assessment is done prior to the patient coming into the office, we want the healthcare provider to make arrangements to have that patient don a mask before they come in and enter the facility through a private entrance. If it's done at the registration desk, we want the patient to don a mask and the patient to be directly taken to an exam room or another well-ventilated area where they can be separated from other people by at least 6 feet. We don't want that patient sitting in the waiting room even with a mask on. We want to get them into a private room right away. Then we'll ask the healthcare provider to go in and do a more thorough assessment. We'll ask them to collect information on vital signs, respiratory symptoms, when they started getting sick, where they traveled, when they traveled, what types of exposures they had while in the country. And if the patient confirms to have consistent symptoms, so fever and respiratory symptoms, If the travel history checks out, then we ask that the healthcare provider call our office and we'll do a consultation on whether testing is needed. So right now, testing can be completed at the state hygienic lab. And just today, there have been some developments with testing. The FDA has been working with reference laboratories to approve EUAs so that reference labs can start doing COVID-19 testing. We know that testing availability is going to be increasing through those reference labs in coming weeks, but there will still be a period of time when the primary bulk of the testing conducted here in Iowa is through our state hygienic lab. So we're in the process of looking at our current testing criteria and trying to make it a little less restrictive so we can continue to do some testing here in Iowa. We do have some restrictions on the numbers of people that we can test, as public health kind of has a finite amount of testing supplies. So that's why we can't just open up the testing to anyone that a healthcare provider wants to test. We need to make sure we're following criteria. But again, in the coming weeks, we know that we're going to have COVID-19 testing available more widely through reference laboratories. We have made COVID-19 reportable here in Iowa. And so as there are positive results coming through these other labs, we will get those reported into our public health system and be working with our local partners to do investigation of reported cases, clusters, and outbreaks. So I want to talk to you a little bit about social distancing, because when we get an indication that COVID-19 is circulating in a community, public health, and by public health I mean our department in cooperation with your local public health departments, are going to be asking your communities to start social distancing. And what that means is that we want everyone to do what they can to stay at least 6 feet away from others. Again, 6 feet is that distance in which we know that we can pass this virus really easily between one another. And as part of this social distancing, we may start asking for certain things to be canceled or postponed. So we have been doing a lot of webinars this week with a lot of different groups within Iowa, and we've talked to our schools and our community colleges and our daycare centers, and we've let them know that we could potentially be asking them to cancel or close or dismiss classes. We've also may be advising that events and large meetings need to be canceled. We may be asking people to not travel unless it's essential. And if businesses have the ability to let their staff work from home, we'll be encouraging that. The bottom line is we want to have people avoid commingling or gathering together in close proximity to each other. So we don't want people hanging out in lunchrooms or hanging out in groups at the mall, that type of thing. We want everyone to try and maintain that 6 foot distance from each other. So we've also had a lot of discussions with businesses, and we're encouraging businesses to kind of think outside of the box. Think of ways that they can continue to provide services, but under this social distancing type umbrella. So for restaurants, that might mean expanding their carry-out services, or if they're still going to serve customers, moving their tables further apart so that patrons aren't sitting close to each other. For customer service businesses, we'd recommend frequent use of hand sanitizers. We're not recommending that the general public start using masks. We just want them to maintain distance between them and others as much as possible. So when we're saying public health will likely recommend social distancing when this virus starts circulating in our communities, that's what we're talking about. We're talking about trying to keep separation between us and others. We're not talking about everybody having to stay in their house and not leave. We're talking about trying to take some of these measures to cut down on the interaction between people in our community. And we're getting a lot of questions about when will social distancing be recommended? What are the triggers for social distancing? And while we're working out kind of broad triggers for doing that, it really is going to be considered on a case-by-case basis. So we're going to base it on the level of activity of the virus in the community, the populations being most affected, and what we know about the virus. And so if there comes a time where we need to recommend social distancing in a community, that's going to be a decision that we make jointly with the local health department. That's going to be a communication to all local partners, and it's not going to be, and it's going to be pushed out through the media so it's widely known. So again, when the recommendation for social distancing is made for a community, this is something that's going to be very visual, and it's going to be shared with all response partners. And as members of your healthcare coalitions, you should be very aware of that recommendation when it's made. We have a lot of different guidance on our website. We'd encourage you to go take a look at that. We can walk through how to get there later in the presentation, but included on the website is guidance for emergency medical providers, and Rebecca Curtis and others today are going to be going through that guidance in greater detail. I mentioned that we've been having a lot of webinars. We've had webinars with all the different groups listed on the slide here. Tomorrow, we're going to be talking to law enforcement. We're also going to be posting some general healthcare provider and local officials presentations on our website. Now, all of these topic-specific webinars have been archived, and we're in the process of posting the links to those webinars on our website. So if you're curious about what was included in the businesses webinar, you're very welcome to go take a look at that and listen to as much as you want. I'm going to touch base on some of the public communications components. Polly Carver-Kim, our communications director, has been incredibly engaged in this response effort, and she's a great resource for us and for all of you. And she gives us a lot of good tips on how to work with the media. She reminds us that we need to, while we can, be prompt in returning calls and scheduling interviews. We know that the media works on deadlines, and we need to accommodate them as much as possible. I know it's tough in response efforts because we have a lot of competing priorities, but we do our best to try to be responsive. I think in this response especially, there's been a lot of rumors, there's a lot of speculation, and so it's tough when the situation's constantly changing, and we just need to communicate that and acknowledge that there will be some uncertainty as these response efforts kind of unfold. We want to be transparent, but we always put confidentiality first. That's especially important as we potentially identify cases of Iowans being infected with COVID-19 in the future. At the state level, we are posting numbers, as I showed on the earlier slide. We're posting the numbers of people being monitored. We're also posting the numbers of people being tested, and those numbers are updated every Monday, Wednesday, and Friday. We aren't identifying locations of people being monitored or tested because there's no public health need to do that notification at this time. There's nothing different that we would tell people in an area where someone's being monitored as opposed to an area where someone was not being monitored. Now, when we have our first case, we will likely release more detail about that situation and make recommendations for the public to make sure that they can take the steps they need to take to stay healthy. Polly's been posting a lot of resources on social media, on our Twitter account, and our Facebook account. I mentioned our webpage, and we'll show you how to get to that later in the presentation, but we have a lot of infographics posted there, and we'd encourage you to use that in your communication with your staff and with the public. We know there's a lot of misinformation, like I mentioned, a lot of rumors. If you have people that are posting comments back to you on your social media feeds, we'd recommend that you don't get into a back and forth with people, but if there's blatant misinformation, feel free to offer the correct information. Here's just an example recently where we had a news station post a graphic that was really taken out of context. And so Polly did provide an update on what the purpose of that infographic was and why it was created to try to alleviate any concerns in the community. Again, I've mentioned that we have a lot of infographics available. Here's a sample of some of the infographics we've developed. There's more going up daily, and if you need assistance, Polly's available to help. Just send her an email or a text message. She prefers email because, as you would expect, she's getting a lot of messages and questions these days, and it helps her kind of work through those requests most quickly. So at this point, I'm going to turn things over to Rebecca Curtis to talk to you about more detailed information specifically for EMS.
Thank you, Dr. Garvey. Please, all of you, don't hesitate to type in your questions into the question and answer box for Dr. Garvey, and we'll follow up with them at the end of the presentation. Also, Dr. Garvey will kind of walk through with us how to get back to the Iowa Department of Public Health webpage so you can see where all of those great references are located. As Ann mentioned, this is Rebecca Curtis. I am the Bureau Chief for the Bureau of Emergency and Trauma Services, and we're going to quickly walk through some references and resources specific to emergency medical services. So Dr. Garvey talked a little bit a while ago about the assessment from the 6 feet. So what we want to encourage our EMS partners to do once they receive the call and they arrive on scene, to assess a patient from that 6-foot different and ask those assessment questions that she talked through. Do you have a fever, respiratory systems? Have you traveled from an affected geographic area? That's China, Iran, Italy, Japan, South Korea, within 14 days of being sick. And then we want to know if that patient had close contact with any persons that were laboratory confirmed to be infected with COVID. If the answer to any of those questions is yes, one or less of those assessment questions, then we need you to start looking at standard precautions for yourself and for all the EMS providers that will be caring for that patient. And if the answer to those questions is yes to 2 or more, then we need you to proceed to airborne precautions. So let's talk a little bit more about that PPE and exactly what that means. So if we're asking you to prepare for airborne precautions because you are suspecting that this patient that you'll be caring for has possible COVID-19, then we want to make sure that you have a single pair of disposable patient examination gloves. And as always, change your gloves if they become torn or heavily contaminated. That you have a disposable isolation gown, that you have respiratory protection and airborne PPE that does include an N95 or higher level respirator, and that you have eye protection. That includes goggles or disposable face shield that covers the front and sides of your face. And please make sure and just be reminded that all personnel should always avoid touching your face while working. If possible, we want to make sure that if you have any indication upon your assessment that you'll be working with a patient that is potentially infected with COVID, that you are consulting with your medical control before performing additional aerosol generating procedures. So what we're talking about is making sure that your medical director, your medical direction are aware and that you are exercising extreme caution when performing additional aerosol generating procedures such as bag valve mask, ventilation, or suctioning or endotracheal intubation. We also just want to remind you that if at all possible, the rear doors of the transport vehicle really should remain open and the HVAC system should be activated during those aerosol generating procedures, and then staying away, of course, from pedestrian traffic. Once the care of the patient is completed, you've delivered your patient successfully to the awaiting hospital. Let's talk a little bit about the documentation and what needs to be done. So we need you to make sure that as the EMS clinicians, once you've completed that transport, that you remove your PPE and perform immediate hand hygiene. Any written documentation should match the verbal communication that you've given. in your report. Making sure that your EMS documentation does include a list of EMS providers and public safety providers that were involved in any response or contact with that patient. And then we need to make sure that that documentation is then shared with local public health authorities so that we can follow up. On arrival to the hospital, after the patient is released to the facility, we need to make sure that you discard and perform hand hygiene. We already talked about that. So, and then just using routine procedures. There's several different resources that are currently available on different websites, our website and the CDC website. So we want to point you to a couple of those. Just some reminders of different aspects of standard precautions. What does that mean for isolation and transmission of infectious disease agents? We want to make sure that you're aware of the reference documents and the resource documents that relate to strategies for optimizing the supply of N95 respirators, because I'm sure, as you're aware, there is questions throughout the United States right now about availability. So we want to make sure that we are using them most effectively and efficiently. And then additionally, a really good document that has been posted to the Department of Public Health website is the EMS Infectious Disease Playbook. And I would highly encourage that all of you go out and take a look at that. So let's talk a little bit about cleaning your vehicle once you've transported a patient with potential or confirmed COVID. So after the patient has been removed from the rear of the ambulance, leave the rear doors open and to allow for sufficient air exchange to remove those potentially infectious particles. This does leave time to complete the transfer to the receiving facility and complete all the documentation, and just plan to leave those doors open to allow for those air exchanges while you complete those other tasks. When cleaning the vehicle, make sure and wear a disposable gown and gloves, face shield or face mask and goggles. Make sure that you use just the procedure for routine cleaning and disinfectant. Using cleaners and water to clean surfaces prior to applying the EPA registered hospital grade disinfectant. So that's nothing new for any of you. And then including those patient care areas in which aerosol generating procedures are performed. Want to touch base real quickly on the use of UV lights. I know that we have done a lot of work over the last couple of years with UV lights and using them for disinfection, but currently we are not recommending the use of UV lights for disinfection for COVID as the sole mechanism for environmental cleaning. They can certainly be used in tandem with the disinfectants that we've already talked about. I'm not going to read these. You guys can certainly look through these slides and then make sure and refer back to the documentation that's available on our website. Just a quick note to think about following the standard operating procedures for the containment and disposal of the used PPE, and then following standard operating procedures for containing and laundering the used linen, and please avoid shaking any of the linen once removed. I want to talk a little bit about the Health Alert Network and the use for our emergency medical services throughout the state. The HAN is a web-based alerting system. It is a membership-based system, and it's used to provide healthcare and healthcare partners related messaging. We're currently using the HAN to send out messages to emergency medical services, but those messages are being sent based on service director information that is currently available in our Amanda registry. So most transporting EMS agencies have been provided with a HAN profile in the past with basic information. We did not ever provide the non-transporting EMS agencies throughout the state access to the Health Alert Network. So because we have come across a couple of issues over the last couple of weeks and getting messages out to EMS providers throughout the state, we are asking that every EMS provider in the state contact the HON officer at the email that is listed there. So we want the service directors to email them, and then we would like to see in that email a primary and secondary point of contact that includes email addresses, phone numbers that we can use for text messaging. I corrected myself. Resource availability, process for requesting the state resources for COVID. So what we are going to do, we understand that there are resource questions about availability and different N95, masks, goggles, all those other personal protective, particularly equipment. We have posted on the HON document library a resource request process document. Once all of you have received access to the Health Alert Network, that also provides you access to the HON document library so that you can get in and see all of the documents that have been created, all the links to the CDC, all of the information directly related to COVID-19, and they will be on the HON document library. Many of you or your service directors have recently or yesterday received a PPE survey. The intent, we sent this out, it is a Google form, it's a Google survey. The intent of this is to try to come up with a baseline throughout the entire state of Iowa on the state resources and personal protective equipment that is currently available throughout the state. We just want to acknowledge that we know that that survey is long. We know that there are several data elements that we are requesting information on. We recognize that burden, but we do have to make sure that we have that baseline. We do expect that those future requests that we'll continue to send out over the next several weeks will be more condensed, and that we will support additional data elements and information feeding back through CDC, because we are also being asked about availability and baseline information that is available in the state. So again, I just want to recognize the burden of that survey, and if each of the service directors throughout the state could at least take a look at that and provide that information back as soon as possible. And there was a deadline provided, and it's noon tomorrow, I believe. Okay. Want to talk a little bit about the healthcare coalitions, the role of the healthcare coalitions, and how EMS services and providers throughout the state can work directly with those healthcare coalitions in preparing for and responding to COVID and pandemic response in general. So the healthcare coalitions have been working very hard over the last several years on community resilience, strengthening incident management, information management, countermeasures and mitigation, and surge management. Now, in almost every single one of those elements, EMS certainly plays a role. So we want to make sure that you are aware of your healthcare coalitions, the coordinators that are associated with each one of those healthcare coalitions, and that there are partnerships being established if they haven't been already. The healthcare coordinator position can absolutely serve as a local resource for EMS services throughout the healthcare coalitions and throughout the states. Please keep those in mind. They can help with providing education, information sharing, and other resource information. As Dr. Garvey mentioned earlier, information that we're continuing to receive from CDC changes frequently, even multiple times daily. We do want to make sure that the EMS services in the state have access to the website and the Health Alert Network folders, so the most recent information can be provided and can be accessed immediately from EMS services. So we will be updating in the HON document library a new folder. So there's several subfolders under the COVID folder that relate to different resources for EMS providers and local public health and healthcare providers throughout the state. But there will be a folder that says new information, and then that is updated daily, so you don't have to sift through every single one of those subfolders for the new information. So that will be really helpful. So those of you that do have a HON profile, now is a really good time to go in and refresh that profile, become familiar with the HON document library again. And if you don't have access to Health Alert Network, please email that email address that we showed a couple slides ago. Just another reminder for EMS services throughout the state to use your existing EMA structure for support needs. Continue to work with your healthcare coalition. If a county and the healthcare coalition cannot support the needs that EMS has, it is imperative at that point that the EMS services are working directly with their local county emergency management agency, that those resource needs are being communicated. Just so you are aware, the Iowa Department of Public Health and the Homeland Security are in close partnership throughout this entire event. We will remain working very closely and providing regular communication related to trends, anticipated changes, what kind of impact state and local responders and capabilities have. There is an event open in Web EOC for COVID-19. The emergency managers have been provided that information, so please don't hesitate to work directly with your emergency managers for any of your resource support needs. So again, I just want to, I think I misspoke earlier, and I want to absolutely acknowledge Mr. Mercer's comment that I said EMS providers rather than EMS service directors. So just clearly, if you can provide communication and information back to us through EMS service directors for the Health Alert Network, that'd be great. I'm going to turn it back to Dr. Garvey for a minute, and she's going to walk back through the screen just to kind of bring up the website again, how to get there, and then we'll take some time to review the questions that we have in the question and answer box and the chat box.
Great, thanks, Rebecca. So bear with me here while I switch my screen over. Okay, so I'm just starting at Google here so you know how to get to our webpage. Our web address is just idph.iowa.gov. This is a little bit embarrassing how slow our internet's running right now. Good grief. There we go. So when you get to our webpage, you'll see our banner. You just click on COVID-19. And that'll take you to our COVID-19 webpage. You'll see where we have the numbers of people being monitored and tested. We also have some general information. And if you scroll to the bottom, we have all of the resources that we mentioned throughout our discussions today. So there's business guidance. I think I referenced that a little bit in our healthcare guidance. And certainly under the healthcare guidance is our guidance for EMS and PSAPs that Rebecca had referenced. There's also some additional guidance. The guidance for healthcare is just the screening guidance. And we've got some just-in-time guidance for testing patients. So there's a lot of resources up there. We've also got some public resources if you want to share those with your employees or your partners at the local level. And Polly's got a lot of great infographics, like I mentioned. Everything's posted here on the website for you to access. So at this point, I think we'll transition and start taking questions. We have a comment from one of our local public health partners that's on the call tonight, just asking for updated talking points. Polly Carver-Kim's working on those, and she'll get those sent out to you likely tomorrow. We have another comment that says, 2 students in my county are returning to Italy in a few days and their parents did not travel with them. The students plan to self-quarantine, which is great. That's our recommendation. What should the parents do? And that's a great question and one that we're getting from quite a few people. I want to direct you to our document under travelers that says instructions for self-isolating. I apologize for the speed of our connection here. So if you go through this document, it does address what about the people that we live with. So this is a great resource that you can share with these families if they have questions. We want these people to isolate themselves to a specific part of the house, specific room. If there's an ability to designate a private restroom for them, that's great. They not only need to stay away from the other people in the house, but also from any animals. And that's just out of an abundance of caution. We know that some coronaviruses can infect animals, and we just want to prevent having any issues. So we're telling people to isolate themselves from other people and from animals. There's no restrictions on where the family members can go. So mom and dad can come and go about their daily business. But again, we want the returning traveling children to make sure they're isolating themselves to part of the room, or excuse me, part of the home, and are staying away from the parents and trying to maintain that 6-foot distance. There's a question about, would social distancing ever be recommended for influenza illness? Certainly, social distancing is a tool that we can use in all different types of response efforts. It's something that has definitely been part of pandemic influenza plans for years. So it certainly could be used then. And again, it's going to be an important tool for us if COVID-19 becomes or starts circulating in our communities. So question about, can PowerPoint presentation be made available before the recording is posted? We'll send both of these out to you as soon as we get that recording archived and the link is available. You may want to clarify that we would not delay treatment of ventilation, intubation, CPAP, but be sure to notify the hospital in advance. Rebecca, do you want to jump in on this? I'm not sure we fully understand the question. Maybe we can have this person reach out to us and we can provide some clarification.
I think I understand the question.
Okay,
and of course, we want to make sure that our patient that is having a crisis that needs our care immediately. But the primary survey and the primary assessment almost always, first of all, includes the safety of the provider. So we do want to make sure that the proper PPE is being used in all of those aerosolizing type of procedures that EMS does on a daily basis. So if those things are going to be required and there hasn't been an ability to make the full primary assessment, then of course move forward with those emergency procedures, but just make sure that we are considering the safety of that provider prior to any care that we continue to provide. The next question is used PPE considered biohazard, like an item that is significantly saturated with blood, or is it standard disposal, okay, similar, non-dripping bandages and gloves, etc.?
Yeah, so we're not recommending that medical waste be treated any differently than it's normally being treated. So just follow your normal protocols for disposing of used PPE. Again, there's nothing additional that needs to be done for COVID-19 over any other types of biohazard. There's a question about, will there be sanctioned EMS transport used to transport any confirmed positive patients. I remember that was a plan during the Ebola scenarios, and that's not something we still take this.
No,
You
go
want me to
ahead.
keep
No,
talking?
go ahead.
So we still maintain a relationship with those designated EMS transport services, but that would not be something that we would automatically jump to in this type of a situation because, again, the PPE and the measures that need to occur to transport a patient with COVID-19 are something that most EMS transport services would be able to adequately provide. And so if there's some kind of special situation where we didn't have local transport available or there was concern, we could always reach back out to those designated EMS transport services, but that's not an automatic like it was with Ebola. Again, this virus is very different than Ebola in infectivity, and again, the recommendations that are in place should be attainable by EMS services pretty widely.
The next question is, where can we purchase an N95 respirator? A lot of places are out. Yes, they are. We absolutely acknowledge that. What our suggestion is that you take a look at your hospitals, you look at your local public health agencies, you work with the other entities and agencies within your healthcare coalition, and work through the process that I went through a couple minutes ago with identifying those partners, identifying your healthcare coalition. If those resources cannot be located to be purchased at all, working with your county emergency manager.
So we have a question about what's the responsibility of EMS? Does EMS have for reporting suspicion of COVID-19 as a whole? And who do you report to? And how will you know if someone you transported is confirmed to have COVID-19? So I'm going to work backwards through this question. So if there is a patient that confirms to be infected with COVID-19, public health authorities will be doing an investigation to try to figure out who potentially could have been exposed to that individual. And if there's exposures, we'll work with those services to make sure that they're aware of it. As far as reporting, really we want that will likely happen at the hospital where the patient's being fully assessed. And so I think as long as, if you have a suspicion, it's important to convey that to the hospital when you transport that patient. But as far as reaching back out to us, that would really be a function of the healthcare provider that assesses a patient upon arrival.
Can we go back to the slide for the HON?
What is the site to register? Okay, hold on. I'm gonna get back into our presentation here.
Sure. What funding is available for non-transport for supplies like the N95 mask? Well, I would put that back to you, is what funding do you typically use for your supplies? And if you're asking if there's any additional state funding at this point for PPE, the answer is no. We are aware that our federal partners are working through some requests for additional funding, but at this point, we do not have access to that. Next question, Rebecca stated that we should contact medical control prior to CPAP, ventilation, or intubation. Oh, I see. That's a follow-up to the initial question. Yes, Brian, I'm calling you out there. Yes, I see what your initial question was now. And of course, always protect the safety of the provider, provide those life-saving skills, those tasks that are absolutely necessary, and then if available to contact medical direction.
Older supplies. If we have, here, just look here.
Okay, if we have N95 masks that are over 5 years old, are they still effective? You gonna answer that, or you want me to?
Go ahead.
what we're seeing at this point is any PPE that is past its manufacturer's date of expected still resilience. We're asking you not to use it at this point. There are certain specific situations when expired PPE can be used. So if you have questions about that, I would suggest that you go ahead and contact us, and we will kind of walk you through what the uses of that PPE can be.
On registration.
How does one receive username password for the HON? Yes, please go ahead, and Dr. Garvey has pulled up the actual email address for the HON officer. If you'd go ahead and email the HON officer at the hon.officer@idph.iowa.gov, email. Oh. Then one of our HON officers will get back to you and provide to you an actual profile that you can go in and set up your password.
We have a great question. Should providers include the self-quarantine recommendations if they're discharging an individual that screens positive but does not meet the testing criteria? Yes, that would be terrific. Again, it's important for people that are returning from travel to one of those affected areas. Again, mainland China and Iran travelers we're going to be monitoring with specific orders, but from the remainder of those level 3 and level 2 travel advisory countries, we want them to voluntarily restrict their movement and stay away from others in their home. And so if you can share that information, that would be terrific. And that document that I showed previously would be a good one to just use as a handout to that patient at discharge. All right, so that covers our questions in the Q&A section. Are you sending EMA's HON messaging?
Yes, the EMAs are getting the messages that are sent out to the healthcare coalitions. And we are inviting them to webinars on a weekly basis.
Great. We're just going to scan through the chat box here.
Can I get masks or gowns? Okay. So there's a comment or question that states, what if you cannot get masks or gowns? I have been told at best we can get some of these things in 4 to 6 weeks. Who can help in getting some of these items? We have tried to get supplies from our other resources, but no one wants to give up their stash. Not surprised. Understand that everyone has their own equipment and wants to hang on to it. But what you need to do is continue to work through those healthcare coalitions. And if there simply are no partners, no manufacturers, no distributors that can offer you any relief or any supplies, then that's when you work directly with your emergency manager to put in the web EOC request.
We had a question about when we send the PowerPoints out, will the hyperlinks be live? We're going to send them as a PDF. And so you might have to cut and paste those hyperlinks. We'll double check that before we send it out so that you know how to get to them. There's a question about would a link for the hospital and healthcare webinar be made available if we didn't get to listen to it? That's all posted on the
website. It's on the website. No, no.
That one's in the HON document.
They are on the HON document library.
Great. Well, we're not seeing any other questions. So again, we want to respect your time and just thank you for joining us tonight. We appreciate all you're doing to respond to this virus and all that you'll be doing in the coming weeks and months. So don't hesitate to reach out if there's questions that you have or if you need additional guidance. We're here to support you all. So have a good night. Thank you.